You mentioned that you have a 2-month-old little girl who falls asleep while nursing, but then as soon as you lay her down, like 10 minutes later, she wakes up and wants to eat again. And you're wondering what you can do because you don't want to be her constant pacifier. This behavior can be normal because a baby loves to be with their mother most, and many babies fall asleep at the breast, and then when you lay them down, they sense a loss of warmth and the comfort that they were experiencing while they were close to you, and this can often stir them and wake them up. What I'm guessing is going on, as long as she's nutritively sucking when at the breast and falling asleep, is that when she wakes up, she's looking for comfort, not necessarily nutrition. And so you can give her comfort in other ways. You could try a pacifier. You can try swaddling her. You can try some ambient noise in the room. Try dimming the lights, reducing other noises that might wake her up. You can even wait a few minutes before responding to her so that she learns the process of self-soothing. At 2 months of age, she is a little bit young to sleep train, but you can slowly teach her how to self-soothe by just going in, gently touching her tummy, reassuring her that you're there, and then turning out and walking out of the room and giving her maybe just another 5 minutes before you go check on her again. And then if she's still crying, give her another 10 minutes. And then if she's still crying, maybe 15. Just slowly and incrementally increase the amount of time you wait before you go check on her again. This way, again, she's reassured that you're there. She doesn't feel abandoned, but you're not giving in to her requests. Because if she cries and you pick her up, she learns that that gives her what she wants most, which is you. And if she needs attention because she's hungry, she needs a diaper change, or she's sick or in need of immediate attention, then of course you should give this to her. But if she's just crying because she doesn't like the fact that you laid her down and it's time for her to take a nap, then you can encourage sleep by waiting a few minutes before you go to respond to her. This won't happen overnight. It takes persistence and consistency. Be persistent about this for about 4 to 7 days, and then you should start to notice that she begins to self-soothe a little bit, or if you go pop a binky in her mouth, maybe she'll go back to sleep on her own. Do keep in mind when you're nursing her that there is a difference between nutritive and non-nutritive sucking, like I referred to earlier. Nutritive sucking is when a baby's actually sucking to get milk, and non-nutritive sucking is when they're sucking just for comfort. And you'll see more of a deep throat, deep jaw action when she's actually sucking to get milk, and you'll hear her actively swallowing. When she's just sucking for comfort, it's just kind of like a little nibble, just like a baby would do on a pacifier. That will kind of help you to tell the difference too between what she's looking for when she's sucking. And of course, if she's just had a really good feeding, she's probably just looking for comfort. I hope these tips are helpful to you. And if you have more questions in the future for me, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.